I am joined by Dr. Chad Mathis from Alabama Bone and Joint, and we're talking about Health Connection. Welcome to the show, Doctor.
Thanks for having me back.
Well, let me ask you first, what is the most common thing that people come in for?
Well, in my practice, the most common thing that I see is rotator cuff tears.
Which surprises me because I wouldn't think that would be very common. From what? What are people doing that's causing this?
Well, usually it's very common in the, as you get older, a large majority of the population will have that. Up to about a third by the time they're age 60 will have a rotator cuff tear.
Really? And so what do you do about it?
Well, you usually have to fix it if they don't get better with non-operative treatment of therapy, physical therapy and some medication. Then we will have to go in there arthroscopically fix it.
Well, and it's not just adults. You see some kids too, and a lot of that's what, sports-related injuries?
Absolutely. That's more of a trauma issue with a kid.
Okay, and so out of all your patients, besides the rotator cuff, what's the second thing that people are normally coming in for?
See a lot of meniscal tears as well in the knee. That is the most common procedure done in the United States.
Is it really? And what's recovery time for that?
That's usually pretty quick, within 4 to 6 weeks back to normal.
What about arthritis? Is that fairly?
Arthritis is very common. You know, that is, as you get older, the wear and tear, degenerative arthritis, you can get treated with that with medications, physical therapy, injections, but ultimately you may end up needing a knee replacement.
Okay, so for all the bone crackers out there watching, you know, the people that crack their neck, crack their back, crack their fingers, does that cause damage to your bones or arthritis?
It's usually if the popping doesn't hurt, that's not a problem. But only if you're popping joints and it's hurting when you do that, you probably shouldn't be doing that.
Well, you've got a couple different locations, right, where people want to come see you, they can?
That's right. We have a Hoover location as well as an Alabaster location.
So in Hoover and in Alabaster, there's the addresses on your screen. Preserve Parkway in Hoover and First Street North in Alabaster, two separate locations. And so, I mean, a lot of people, I assume, wait to come to the doctor until they absolutely have to. But some of this, should you be proactive with some of this? If you're noticing little kinks or little back issues or shoulder issues, should you go ahead and just get to the doctor?
Well, some of it you can give it a little bit of time, but if it keeps bothering you after a few days, definitely want to come in and see either your local primary care doctor or coming in to see one of us.
Any advice or tips to viewers out there watching as far as avoiding injury?
Always be smart, especially with shoulder injuries, keeping things in front of you and not out and away from you and behind you. That puts a lot of stress on the rotator cuff.
So people that are always extending backwards to grab stuff.
That's right.
Weightlifters, a big issue too? People that are lifting weights?
They do. They get specifically rotator cuff and acromioclavicular joint problems.
Oh, geez. What we all look forward to, right, Doctor?
That's right.
Okay, the website on your screen, you can go to abc3340.com, click on Health Connections if you want more information. There's also a community tab, and go to Health Connections from there. Either way, that's how you can get a hold of us and certainly Dr. Mathis. Thanks for your time.
Thanks for having me.
We appreciate it. We've got a now